Tab-A-Vite is a multivitamin product that is used to treat or prevent vitamin deficiency caused by a poor diet, certain illnesses, or during pregnancy. Vitamins are essential for the body and help maintain good health. It is important to take Tab-A-Vite as directed by your doctor or pharmacist. The usual dosage is once daily or as directed. It is best to take Tab-A-Vite with a meal to help with absorption. Make sure to follow the recommended daily dosage and timing for the best results. When taking Tab-A-Vite, you should take it by mouth, typically once a day or as directed by your doctor. Make sure to follow the directions on the product package and do not exceed the recommended dosage. It's important to take this medication regularly to get the most benefit from it, so try to take it at the same time each day to help you remember. If you have any questions, you can always ask your doctor or pharmacist for guidance. Some common side effects of Tab-A-Vite include constipation, diarrhea, or upset stomach. These effects are usually temporary and may go away as your body gets used to the medication. If these effects persist or worsen, it's important to talk to your doctor or pharmacist. If your doctor has prescribed Tab-A-Vite for you, it's because they believe that the benefits outweigh the potential side effects. Most people who use this medication do not experience serious side effects. While it's rare, a very serious allergic reaction to Tab-A-Vite can occur. Seek medical help immediately if you experience symptoms such as rash, swelling of the face/tongue/throat, severe dizziness, or difficulty breathing. It's important to note that this is not a complete list of possible side effects. If you notice any other effects not mentioned here, it's advisable to contact your doctor or pharmacist. As for the best time to take Tab-A-Vite, it's typically recommended to follow the dosage instructions provided by your doctor or on the product label. If you have any concerns about the timing or dosage, be sure to consult with your healthcare provider. It's important to keep multivitamins that contain iron out of reach of children, as accidental overdose of iron-containing products is a leading cause of fatal poisoning in children under 6 years old. If an overdose does occur, it's important to seek medical help immediately or call a poison control center. Before taking Tab-A-Vite, it's important to talk to your doctor or pharmacist if you have any allergies to its ingredients or to soy/peanut. This product may contain inactive ingredients that could cause allergic reactions, so it's important to discuss this with your pharmacist. It's also important to discuss your medical history with your doctor or pharmacist, especially if you have a history of alcohol abuse, liver problems, or stomach/intestinal problems. If your multivitamin contains folic acid, be sure to tell your doctor or pharmacist if you have a vitamin B12 deficiency before taking it. Folic acid may affect certain lab tests for vitamin B12 deficiency, which could result in serious nerve problems if left untreated. Before undergoing surgery, make sure to inform your doctor or dentist about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. If you are pregnant or breastfeeding, it's important to consult your doctor before using Tab-A-Vite. When taking Tab-A-Vite, it's important to be aware of potential drug interactions. Certain medications or supplements may affect how Tab-A-Vite works, or increase the risk of side effects. It's important to keep a list of all the products you use and share it with your doctor and pharmacist. This includes prescription and non-prescription drugs, as well as herbal products. If your multivitamin contains iron, it's best to avoid taking it at the same time as antacids, bisphosphonates, levodopa, thyroid medications, or certain antibiotics. Talk to your doctor or pharmacist about how long you should wait between doses and for help finding a dosing schedule that works with all your medications. If your multivitamin contains folic acid, be sure to inform your doctor or pharmacist if you take certain anti-seizure drugs. Additionally, Tab-A-Vite may interfere with certain lab tests, potentially causing false results. It's important to make sure that lab personnel and all your doctors are aware that you are taking this medication. It's important to follow these guidelines to ensure that Tab-A-Vite is taken safely and effectively. If someone has taken too much Tab-A-Vite and is experiencing serious symptoms such as passing out or difficulty breathing, it's important to call for emergency medical assistance. In the U.S., you can call the local poison control center at 1-800-222-1222. In Canada, residents can call a provincial poison control center. Symptoms of overdose may include stomach pain, nausea, vomiting, and diarrhea. It's important to seek medical help immediately if you suspect an overdose. Remember to keep all your medical and lab appointments. Some brands of Tab-A-Vite may also contain ingredients like docusate. If you have any questions about the ingredients in your brand, be sure to ask your doctor or pharmacist. It's important to note that Tab-A-Vite is not a replacement for a healthy diet. It's always best to get your vitamins from nutritious foods. Be sure to maintain a well-balanced diet and follow any dietary guidelines given to you by your doctor. And as always, consult with your doctor before starting any new medication or supplement regimen. If you are taking Tab-A-Vite on a prescribed schedule and happen to miss a dose, take it as soon as you remember. However, if it is close to the time of your next dose, it's best to skip the missed dose and take the next one at the regular time. It's important not to double the dose to make up for the missed one. Remember to always follow the instructions given by your healthcare provider. When storing Tab-A-Vite, make sure to keep it at room temperature and away from light and moisture. It's important to store it in a place that's out of reach of children and pets. When it comes to discarding the medication, it's best to consult your pharmacist or local waste disposal company to ensure it's disposed of properly. And remember, don't flush Tab-A-Vite down the toilet or pour it into a drain unless instructed to do so. Properly dispose of the product and it's expired or no longer needed. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.